Hi, Dr. Yass here. In this video, I want to clarify an issue that I think is really limiting people from obtaining the proper treatment they need in the shortest period of time because there is a lack of understanding of what this concept represents. And that is the idea that you've had an injury and that injury requires time to heal before you get treatment to resolve the pain associated with the injury. This concept of injury is being misconstrued as if it's an entity. It's not an entity. It represents an incident. When you have an injury, it represents an incident in which a tissue is brought into distress. So you have to try to establish which tissue has gone into distress to know whether resting and allowing the tissue to heal is the proper course of action or whether it requires immediate intervention. So let's say you had an incident where you were hit by a car or you fell off a bike or something that appears to have some traumatic event. It's an incident. So the natural tendency is to seek care. And then since it was an incident culturally and medically, people say, well, you need to rest. Well, let's take a closer look at that. So let's say that you were on a bike, you fell and you hit your knee. So now you have pain at the knee area. So just because the incident led to pain at the knee doesn't necessarily mean that the immediate action should be rest. So let's take the concept, well, you have pain at the knee, they take an x-ray, and it appears that you fractured your patella, and in fact, it's split or something of that nature. Well, certainly, that's the type of situation that would require some type of rest period. Maybe a surgery is required, but certainly the ability to allow the fracture to heal, even if it doesn't require surgery, makes sense. But let's say in how you fell, maybe you caused a contusion to the front thigh muscle, the quad. And that's creating pain at the knee area. Well, in a case like this, if due to the contusion, the muscle has weakened and is impeding the ability to weight bear and allow the kneecap to track properly through the knee joint as motion occurs, that's the type of thing that you wouldn't want to rest at all. In fact, resting, say, not weight bearing for some period of time will actually allow the muscle to weaken further, thereby making it harder to perform weight bearing and allowing for proper tracking of the kneecap through range of motion. So resting in the case when a muscle is the tissue in distress that is the result of the incident or injury is about the worst thing you can do. And when you look at the types of things that happen to people, oh, I was bending down to pick something up and I felt pain. Oh, I was kneeling down and I felt pain. Oh, I was reaching behind me and I felt pain. When you look at the types of injuries that are occurring, you will notice that in the highest percentage, they're actually indicating that the tissue in distress from the injury was muscle. And therefore, the worst thing you can do is rest. The idea that rest is the answer to diminishing or resolving the pain has to be determined based on the tissue in distress that has gone into distress from the result of the injury or incident. Okay? So stop thinking that the mere fact that you had an injury justifies rest as the proper procedure to occur after the incident. Please think about the fact that you need to identify what tissues in distress as a byproduct or resultant of the incident or injury, and then determine whether rest is the appropriate response to the distress of that tissue. I am promising you that in almost most of the cases that you're experiencing your injuries, you are having muscular deficits, and any attempt to rest to diminish the pain is basically simply elongating the time frame that you're having your pain, or even worse, making you more susceptible to having the pain reoccur once you go back and try to do activity again. Okay? This is a understanding that really is isolated to the Yass method. Most of what I talk about, the theories have developed through the process of creating and evolving the method as I've treated people. So it's very important. I want people to realize that injury is not what we treat. We treat tissues. So because an injury occurs, it is not enough to say that I need to rest because of that injury. I need to know what tissue went into distress due to the incident or injury, and then determine whether rest is the appropriate treatment, or whether, if in fact it's muscular, I need to immediately, even while I'm in pain from the injury, this is the part people aren't getting, I need to address that muscular deficit. And in resolving the muscular deficit, I will resolve the pain I'm experiencing and prevent it from reoccurring again. Hopefully you find this video helpful, and if so, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and hit the bell icon to get notifications when new videos are added or when I'm live on YouTube. If you'd like to contact me about your particular issue and you think that maybe I can help you, by all means, contact me at email, drmitch@mitchellyass.com. If you feel that the Yass method would benefit you, then you can schedule a Yass method treatment by going to my website, livewithoutpains.com. You can hit /sessions or just livewithoutpain.com. You'll see a schedule now button. Click on that. That takes you to the Calendly scheduler page. You can either choose an in-person session in Jacksonville, Florida, or a Zoom session. And we will evaluate you and treat you within that session and show you if, in fact, it's muscular, how easy it is to resolve muscular deficits and get you back to full function and living the life you so justly deserve. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye.